Welcome to Community Health Matters. I'm your host, Amy Marsalis. On today's show, we're going to discuss suicide awareness, affordable dental care options, and computer-aided joint replacement surgery. All of that coming up next on Community Health Matters. From the News Channel 5 network, this is Community Health Matters, sponsored by the United Health Foundation. Hi everyone, so glad to have you join us today. First off, I want to say that September is the month that's dedicated to Suicide Awareness Month across the country. Very sad, Dr. Fiscus, that we have to have a month dedicated to bringing awareness to this subject, but important that you're here to discuss it with us. So thanks for coming in today.
Thank you.
Why is there such a prevalence of suicide, particularly, as I understand it, here in our state?
We have a higher than the national average prevalence of suicide, quite a bit higher actually. And what many people might be interested to know is that our most at-risk population are white males between the ages of 45 and 65 who might be turning to suicide because of economic downfall, because of relationship issues, because they might be a population that is a little reticent to get help or might be embarrassed about talking about the need for mental health. So it's really important to have platforms like this where we have an opportunity to raise some awareness around the trouble we have with suicide in Tennessee.
Why in particular, though, in Tennessee? Is it because at least in the Nashville and Middle Tennessee area, it seems like our economy is strong, but what accounts for this high number? Well,
we know that many of the suicides that occur happen in rural areas, and Tennessee is a pretty rural state. We don't always have behavioral health resources available to people who live in smaller counties or more rural areas who might have to drive a significant distance or may have trouble with insurance covering behavioral health services. That's a big problem. And then there's, I think, maybe a little more of a perceived stigma around mental illness in the South compared to other areas of the country that might be a little more receptive to understanding that mental health is just another part of physical health. And when we cut the head off from the rest of the body, then you know, unfortunately we start to lose that need for complete person health that we have.
What about, okay, you're a pediatrician, so I know you're here to talk about prevention among youth, among kids.
Right.
It's just, this is just such a sad state of affairs. I know there was a story recently over the summer about a 10 or 12-year-old little girl, not in this area, that took her life. Why are you seeing more children?
There's been a huge uptick in youth suicide and in youth suicide attempts. Those numbers have tripled over the last 5 years, and we're now losing a child in the state of Tennessee about 33 times a year, which is, I mean, that's a lot, you know, one every 10 days or so in our state. Part of it's social media, you know, something that we didn't have when we were growing up. Now these children see their friends on social media who are portraying the absolute most precious, perfect picture of themselves, and those children may not be able to see themselves that way. And also it provides a channel for bullying and sometimes anonymous bullying, where children are just so young that they don't really know how to cope with that or find resources to help themselves.
Is that something the state is engaged in with schools, school administrators, teachers on preventing the bullying epidemic?
Yes, well, the Department of Education has worked very hard on bullying within schools, and then also the Tennessee Suicide Prevention Network works very closely with schools, and we're actually the first state in the country to have a law that requires every school in the state to have a prevention, intervention, and post-intervention suicide plan in their school, and that is a combination of a couple of different laws over the last several years that have come into play. But this most recent iteration was just signed by the governor in 2016. So hopefully we're going to see more on the front of confronting bullying, but also being proactive around suicide in the school system for these younger kids.
What are some of the signs, symptoms that you tell parents as well as teachers to look out for among these kids that are at risk?
Yeah, the great thing is that we all know someone, right? So if everyone is watching out for everyone, then this might be something we can get ahead of. So if you have a youth who becomes very socially isolated, you know, it's normal for them to want to be up in their bedrooms as teenagers. That's where mine are. But if they're no longer engaging in any kind of social activity, no longer enjoying the things that they used to do, they've dropped out of their sports, they're no longer going to the football games on Friday nights, early substance abuse, alcohol use, especially under the age of 13, if they know that their child's being bullied, and then in even older people, if they don't have stable family relationships, stable social relationships, in older folks, if they're starting to give away their possessions or being much more withdrawn, then those are definitely warning signs, and it's much better to speak up and talk to that person or try to get them help than to think it's going to go away by itself.
I saw the list. I don't know if we could pop that up again, but the first thing on that list said wanting to die, them talking about it.
Right.
So that, I'm surprised that children would even verbalize that, but some do.
Some do, and it's hard in youth to discern that sometimes because, you know, you don't let your daughter go out on a Friday night somewhere and she might in a huff say, I want to die. And that's not the same as a child who out of some other kind of circumstance says something like that. So parents can justifiably have some difficulty figuring out how seriously to take those kinds of statements from their children. And probably the best thing to do is to call their pediatrician or their child's health care provider and discuss that with them and run it by them and see if maybe it's time to get some professionals involved.
Okay, and as we wind up here, for someone who may be contemplating taking their lives or feel they need help, where should they turn?
There's a couple of really great resources. There is a texting service, so if they're shy about calling someone or not sure what to do, they can text to 741-741 and text in TN and immediately get a response from someone that can help them with their feelings about suicide and get them connected. There's also a national hotline, 800-273-TALK, that they can call to get someone, and that's their 24/7, 365 as a resource.
All right, Dr. Fiscus, a tough subject, very delicate subject, but one we need to talk about because, as you said, mental health is every bit as important as the rest of our body.
Exactly right.
Thank you
so much.
so much. All right, we'll be back with much more right after this.